is an extremely exciting time because we're seeing movement in healthcare that we've never seen before, disrupting the marketplace, entirely led by the most unlikely group that any expert predicted, and that is employers. They're demanding better. They want more value. There's more options on the market for them. Reference-based pricing is becoming far more dominant in the marketplace. It has the promise of reining in surprise billing, and it also ensures that claims are paid out at a fair amount. I'm always struck by how hospital services outpace inflation faster than any other industry in the United States. The less transparent the marketplace, the more you see price inflation. This is where many of us in the health policy community and academics look at reference-based pricing as one of the ways to rescue us from this crazy game that nobody ever designed to be this nuts. When American hospitals were built, they were built to be a safe haven for the sick and injured, not a place where people go and get gouged, not a place where they're taken advantage of financially. And this represents a violation of everything sacred about the public trust in the medical profession. We need more public accountability for the hospitals that are not complying with the federal regulation. We want to know what the real prices are, and we want to know what those agreements are with the different insurance companies so that we can start coming up with fair reference-based pricing for a region. Imagine that you go to look up the price of a flight when you're shopping and there's no prices. The airlines have a statement that they can't give you a price, they just don't know what their true cost will be. This would be absurd, right? There would be price gouging in the marketplace. The fundamental problem in healthcare is that we have non-competitive markets. The real change is to transform those non-competitive markets into competitive markets. ELAP, Imagine Health, you guys are really setting a standard for prices that otherwise have no orbit in outer space, and they need to be anchored to something, and that's exactly what reference-based pricing does in the market, and that's what ELAP and Imagine Health does, and that's where you guys have been great leaders. So thank you for what you're doing in healthcare.